Zang, The Organ System of Traditional Chinese Medicine by Jeremy Walls, page 225, chapter 17, Clinical Methods. Education of the patient. The aim of a diagnosis is the clear perception of the different patterns of disharmony involved in the patient's illness. This enables correct choice of points and the method of point use. Also, once the different originating and aggravating factors of the illness are understood by the practitioner, this understanding can be transmitted to the patient so that he or she can take the necessary steps to avoid or to reduce these factors. Treatment and education combine to relieve the disharmony, and the practitioner and the patient work together to remedy the disease. In some simple situations, treatment alone may be sufficient. In others, the disharmony may be redressed solely by the remedial actions of the patient. Generally, however, both the acupuncture treatment and the correct remedial measures carried out by the patient are required to achieve lasting improvement. This is especially true in the complex cases of chronic deficiency seen in the West. Unless the patient is given a clear understanding of the origins of the illness and shown what remedial procedures to adopt, the disharmony may drag on indefinitely, although partly relieved by acupuncture treatment. In other words, the appropriate actions of patients to help themselves can greatly reduce their suffering and their need for acupuncture or other medical treatment. There are two main aspects of patient education. The first is concerned with the identification of the originating factors of the illness, and then with prescribing the appropriate remedial measures to these factors and to the pathological changes associated with them. The second is concerned with helping patients at a more personal level. To help people to help themselves, it's first necessary to help them to understand themselves, then to accept themselves, and yet also to determine to change themselves. This is the basis of patient education. Identification of originating factors and selection of appropriate remedial measures. This section relates back to the chapter on origins of disease. Since the aim of patient education is to identify the originating factors and then to show the patient how to avoid or reduce them. The three main categories of originating factors are external, internal, and neither internal nor external. The three tables below list each originating factor with an example of appropriate preventative or remedial measure, and give an example of a common disease pattern in which the originating factor may be involved. Some of these preventative and remedial measures may seem absurdly obvious, yet, if people consistently adopted these measures, there would be little ill health and disease left in this world. People are either ignorant of them or unwisely ignore them for various reasons. Patient education, therefore, consists in giving patients a clear picture of the originating factors of their illness and in showing them the appropriate measures of self-help. We will now consider some of the examples listed in the tables in a little more detail. Common cold. Invasion of Fei by external wind cold may result in impairment of the dispersing function of Fei, just as the latter may facilitate invasion by wind cold. This wind cold may give rise to heat in Fei due to stagnation resulting from the weak dispersing function, and in turn, this heat may weaken the dispersing function further. The deficiency of the dispersing function of Fei and heat in Fei are both aggravated by the habit of smoking. If Qi is deficient and insufficient Gu is formed, then Fei Qi may become deficient and the dispersing function of Fei may be reduced. Also, if the weakness of Qi leads to the formation of phlegm, this may accumulate in Fei due to the retardation of the dispersing function, which it further weakens. Remedial measures might include 1. Avoid external disease factors such as wind and cold. 2. Breathing exercises and physical exercises to strengthen Fei Qi and the dispersing function of Fei to disperse phlegm. 3. Stop smoking to reduce heat in Fei and to avoid further damage to Fei Qi. 4. Improve diet and regularize eating habits to increase Pi Qi and hence Fei Qi and defensive Qi, and hence to increase the resistance of the body to external invasion. Headache. Headache may be associated with many disease factors and with many patterns of disharmony. It may arise from invasion by wind cold, wind heat, or wind damp, from deficient Shen Yin or deficient Shen Yang. It may be associated with deficient Xue, deficient Pi Qi, or turbid mucus in the upper body. It may result from trauma and from stagnant Xue. Especially, it often occurs with patterns of disharmonies of Gan and Dan, especially depression of Ganqi, hyperactive Ganyang, blazing gunfire, and steering of Gunwind. Assume a situation where anger and frustration are associated with depression of Ganqi and with uprising of Ganyang. Mental irritation is associated with deficient Shen-Yin and deficient Gan-Yin, again, giving rise to hyperactive Ganyang. This results in disturbance of movement of Qi in the channels of the head, especially in channels of Gan and Dan, which is further aggravated by the invasion of the head and neck by external wind cold. In such a case, the patient could take the following measures to avoid or to reduce the force of the precipitating factors. 1. Avoid exposure of head and neck to wind cold. 2. Avoid situations of stress and emotional flare-up. 3. Avoid irregular patterns generally, and especially those of irregular and insufficient sleep, to avoid aggravation of deficient Shen-Yin and hence deficient Gan-Yin. 4. Avoid alcohol and grease food, which might aggravate the flaring of depression of Gan-Qi into hyperactive Yang or blazing fire. Haematuria. Haematuria, the occurrence of blood in the urine, may result from one or more of the following factors. Trauma, physical injury to a part of the urinary system, kidneys, uterus, bladder, or urethra. Physical overwork. This can weaken Shenqi, so that Shenqi descends, and Piqi, so that Pi cannot properly hold Xue in the Xuemai, resulting in hematuria. Chronic illness. This can also weaken Qi of Shen and Pi, resulting in blood in the urine. Excess sex. Depending on the inherent tendency of the patient and upon the circumstances, excess sex can weaken either Shen-Yin or Shen-Yang. Deficient Shen-Yin may give rise to heat within Shen, which may result in bleeding directly or via Gan or Shen fire. Deficient Shenyang may give rise to deficient Piyang, and the two together may result in the inability of Yang Qi to hold Xue in Xuemai, as with chronic illness and physical overwork. Emotional disturbance. Fear and fright may give rise to weakness of shenchi, but the commoner emotional origins of haematuria are stress, mental irritation, mental overwork, and frustration and anger, giving rise to deficient Sheng-yin, blazing gun fire, and blazing Shin fire. If Shin fire is transmitted downwards via Xiaoqiang, it may reach Pangwang, causing inflammation, irritation, and haematuria. Also, gunfire may be transmitted downwards via Ganjin which connects with the urogenital area to Pangwan with similar results. The heat accumulating in Pangwan from one or more of these sources may result in heat in Xue and in subsequent leakage of Xue from Xuemai. Hence, appropriate remedial measures for the patient might include 1. Avoidance of excess physical work or exercise. Wrist, the injury heals, and wrist, Shen and Pi regain strength. Avoidance of external cold and damp. 2. Avoidance of excess sex, especially when emotionally upset, tired, ill, or recu- recuperating from chronic or acute illness. 3. Avoidance of mental overwork, mental stress, and emotional upset. Regular and adequate rhythm of nutrition, rest, and sleep to nourish in, so that it may control fire. The common cold was taken from the table of external factors, headache from the table of internal factors, and hematuria from the table of miscellaneous factors. However, in clinical practice, as can be seen from these three examples, disease factors of all three types may be involved in a single disharmony. Helping patients to help themselves. In the West, the main origins of disease are not physical factors, but disharmonious patterns of thought and emotion. Changing these ingrained patterns of disharmony is the most important, but the most difficult part of patient dedication, since most people are distinctly reluctant to change their personalities. The regulation of these deeply embedded patterns of cleaning and belief is the core of patient education. Since some individuals cannot cope with this at all, and since most people can only deal with change in limited amounts, progress must be gradual, a little at a time, and only at a rate within the capacity of the patient. There are three components to the basic formula for change: understanding, motivation, discipline. Understanding. Patient must first understand, as thoroughly as it appropriate, the pattern of their disharmony in the context of the pattern of their lives. They need to know which aspect of their makeup or behavior became the originating factors of their illness. In this way, they can understand which of their pattern of thought, emotion, and behavior need to be modified, and thus which preventative and remedial measures are appropriate. Motivation. Understanding alone is not enough. There must be the motivation to put the understanding into practice. This can only come from within the patient. The practitioner may act as a catalyst, but cannot supply motivation to a person who altogether lacks it. Discipline. Momentary enthusiasm, temporary motivation is useless. Changing ingrained patterns of thought and emotions is the work of a lifetime. Discipline is a steady application of understanding and motivation over long periods of time, despite setbacks and discouragement. This is the only way that lasting change can be effective. Discipline does not mean sudden, harsh harsh bursts of self-torture and deprivation. It's a slow, steady, gentle implementation of change, discarding the deleterious and nurturing the useful. Summary: the education of the patient rests on the foundation of the clear perception by the practitioner of the patient's disorder in the context of the patient's life and environment. The practitioner must then communicate this understanding to the patient. From this understanding and from the practitioner's encouragement and support, the desire and the motivation for change may arise within the patient. If the patient can develop the discipline to sustain this motivation and to apply the understanding over a period of time, he has a means for long term health. More specifically, the practitioner needs to know the appropriate remedial measures for different disharmonies and different situations, and the patient, once informed of them, needs to carry them out. Summary of the sequence of clinical procedures. Let us assume that a patient comes to the surgery complaining of ache and soreness in the lumbar region. What would be the likely sequence of clinical procedures, and what is the logic behind them? Preliminaries. It is assumed that the practitioner is physically fit and mentally calm. The practitioner must be completely fluent with all the theoretical principles and be familiar with all the main patterns of disharmony and common disease patterns and their common permutations and combinations in clinical practice. The practitioner must also be competent with all the major techniques of the diagnosis and treatment and be perceptive and supportive in dealing with the patient. The sequence. As soon as the patient walks through the door of the surgery, the practitioner is starting to build up an understanding of the patient's pattern of disharmony. The practitioner seeks to organize information from the three main areas of diagnosis: observation, interrogation, pulse, and tongue. In terms of the basic framework of TCM, yin yang, 8 principles, disease factors, and the pattern of disharmony of substances, Jing and Zang. General, general principles: acute or chronic. The first question concerns whether the disease is acute or chronic. If acute, is it genuinely acute, or is this an acute crisis on underlying chronic pattern? 8 principles patterns of disharmony. The next questions involve the 8 principles pattern of disharmony. Is the disease external or internal? And if external, is it purely external or external due to or mixed with an underlying internal pattern? Is it a pattern of heat or cold, an oscillation between, or a combination of both heat and cold? Is it a pattern of excess or deficiency? And if excess, is it a genuine excess, or is it temporary or a local excess on an underlying pattern of deficiency? Finally, is it a yin pattern or yang pattern? Disease factors. It is also necessary to know which disease factors are involved. External factors such as wind and cold, internal factors such as anger and fear, miscellaneous factors such as trauma and malnutrition may all be involved. Substances, Jing and Zang. The practitioner aims to determine which pattern of disharmony of the substances are involved, such as deficient qi or stagnant shui, whether this is a disharmony predominantly of Jing or Zang. and which Jinglo or Zanfu are involved. Backache in general, acute or chronic. The backache may be purely acute due to recent trauma with resulting local stagnation of qi and shui. Alternatively, an accident of the years ago might have left an area of potential weakness of circulation of qi and shui that is periodically activated by invasion of wind cold. 8 principal patterns of disharmony. Exposure to extreme wind, cold, and damp may give rise to an acute external condition. Congenital weakness of the lumbar area may be associated with a chronic internal pattern, or the latter may predispose to invasion by external disease factors, producing a chronic internal condition with periodic acute crisis due to external invasion. The condition may be associated with cold or with heat, whether external or internal. Alternatively, internal cold and damp in the body may give rise to damp heat. And finally, the pain may be associated with either deficient yin or deficient yang. Disease factors. The main external disease factors involved include wind, cold, and damp. The main internal disease factors involved include fear and fright that may injure Shenqi and Shenyang, and mental and emotional stress that may injure Shenyin. The main miscellaneous disease factors involved are insufficient, excess or inappropriate exercise, overwork, excess sex, inherited tendency, trauma, malnutrition, and occupation or general poor posture and usage. Substances, Jinlo and Zongfu. The common substance disharmonies in lumbar conditions are deficient qi, deficient jing, and stagnant qi and shui. This may be in terms of Jinlo alone, specifically those of Pangwan and Dumai. Or, in addition, Zangfu may be involved, specifically Shen, for example, deficient Shenqi, deficient Shenjing, deficient Shenyin, or deficient Shenyang. Alternatively, the downward pouring of damp heat into Pangwan, discussed on page 80, may include among its signs stabbing or severe lumbar pain that is associated with urinary stones, dysuria, or haematuria. In female patients, lumbar pain may be associated with menstrual disorders or with pregnancy. A specific case of lumbar pain. Clinical situations are rarely simple. There is rarely a single originating factor, but usually a combination of various factors. Let us take a specific case. A man of 30 years of age came from a family prone to lumbar pain. At the age of 18 and 20, he had accidents involving the lower back, but no subsequent problems at the time. From 22, he started his own business, which involved much overwork, tiredness, and stress. At 24, in an attempt to regain physical fitness, he started weightlifting. From 23 onwards, he had more or less continual lumbar soreness, worse in winter, and generally aggravated by cold and damp. At 30, in addition to this, he had a stabbing pain in his left lumbar sacral area following a session of weightlifting and persisting until the patient first came for a treatment. The practitioner perceived the pattern as follows. It was a chronic condition with periodic crises occurring for various reasons. There was an underlying potential weakness in the circulation of qi and shui in this area, due to both inherited tendency and early trauma. This pattern of weakness manifested as lumbar pain when the weakness was aggravated by overwork, tiredness, and stress. These factors injured Shenqi, Shenyang, and Shenyin, increasing the weakness of circulation of qi and shui in the lumbar area. This disharmony was therefore not solely one of Jinglo, but of both Jinglo and Zangfu. Since excess work or lifting injuries Shan, this condition was exacerbated by the weightlifting, which in itself and in moderation is a useful exercise, but unwise in this case. The pattern of deficient qi and stagnant qi and shui in the channels and collaterals of the lumbar area were worsened by the invasion of external cold and damp, factors tending to retard and obstruct the flow of qi. Also, prolonged exposure to cold and damp tends to injure shenyang. Finally, the weakened state of the back results in a local injury during weightlifting, associated in TCM with stagnant shui. In this case, the principle of treatment was to warm and strengthen Chenqi and Shenyang. In order to strengthen the circulation of qi and shui in the lumbar region and to disperse the accumulation of cold and damp, points selected in this context were used with reinforcing method and moxa. In addition, points were used with an even method and moxa to relieve pain and disperse stagnation in the area of the recent injury. Shanshu, bladder 23, to strengthen Shenqi and disperse cold and damp. Mingman, do my 4, to strengthen Shenyang and to strengthen back. Weichong, bladder 54, added since there was a history of stagnation of qi and shui, and also because there was a recent acute pain below the level of shenshu. If the blood vessels in the popliteal fossa appear congested, it is permissible to use strong stimulation or to prick Weichong to produce a drop of blood. Kunlun, bladder 60, as a point for chronic lumbar pain to remove obstruction from the collaterals of the back. Guanyuanshu, bladder 26, added on the left side only to relieve pain and stagnation following the recent injury. The patient was given a clear understanding of the origins of his back problem and its likely future progression. He has advised to avoid exposure to cold and damp, to stop weightlifting, at least temporarily, and to put more emphasis on swimming and on other relatively gentle exercise, to keep the back both invigorated and supple. He was advised to attempt to reduce overwork, whether it's attendant stress and tiredness, and to get more sleep and rest to rebuild Shenqi. The importance of regular eating habits and of adequate nutrition was emphasized, since the replaceable part of Shenjing derives from food and drink and the action of Piqi. Summary: three main areas of clinical practice are diagnosis, treatment, and patient education. The three main methods of gaining information in diagnosis are observation, interrogation, pulse, and tongue. In differential diagnosis, this information is organized in terms of yin-yang, 8 principles, disease factors, substances, Jinluo, and Zangfu, and choice of principles of treatment, of points, of method of point use, and of modes of patient education are decided on this basis. A simple sequence of clinical procedure was outlined using the example of lumbar pain.